Let's talk about that developing story from Lagos, where about 5 persons have reportedly died and 60 others hospitalized from the outbreak of severe gastroenteritis in communities that cholera. And joining us is a medical doctor, Odunola Olabintan. Thank you very much for joining us on TVC News at 10. Well, how worried are you about this, and what's your assessment of the Lagos state government handling of this medical situation?
Hi, good evening, and thank you for having me on the news today. I am quite worried about the cholera outbreak in Lagos because the rainy season has just started, and as it is known, cholera outbreaks increase during rainy season, and as we are having cases already at just the beginning of the rainy season, it huge cause for concern because I'm thinking that we might see more cases as the season progresses due to poor hygiene and unsanitary disposal of waste. And pertaining to how Lagos State government is handling it, I think they are handling it well. The commissioner has come out to put out statements, and he has put out emergency contact to call, and the response to the hospitals have also been tightened. So yes, Lagos State government is handling it well.
Let's talk about the people. What should we know at this time, and what can we do to prevent further spread of this?
Well, we have to know at this point that cholera is a very contagious disease. It spreads through fecal-oral routes. It spreads by ingestion of contaminated food and water. And things that propagate it are things like unsanitary disposal of waste, especially feces, and not having access to clean water. So at this point, we have to know that if anyone has symptoms of gastroenteritis, that is vomiting and diarrhea, maybe fever, they should not take it lightly. They should go to a hospital as soon as possible. Although most people who come in contact with cholera would only have mild, moderate symptoms, please make sure that they still go to the hospital. And home care can include, using oral rehydration solutions, popularly known as ORS, and protect yourself. Please make sure that you wash your hands from time to time. Make sure you don't take water that's not being, cleaned, so like disinfected using chlorine, or you have to boil your water before you drink it. Don't take fruits and vegetables that you don't know their source, or don't eat them raw. Make sure you wash them thoroughly, or cook vegetables as the case may be. Just make sure that you put it.
All right. And what more really can government better equipped to actually cater to the need of people who go there for care?
Well, hospitals at this point need to, strengthen their triage system. So triage is when you go to hospital, they categorize cases by, emergency, non-emergency, and things like that. So at this case, we have to be vigilant in hospitals to recognize that there's a cholera, outbreak, a potential cholera outbreak, and that when doctors, clinicians see a case of acute gastroenteritis, we have to be on the alert. Make sure that the person gets tested for cholera so we know exactly what we're dealing with before they are sent home. And, prioritizing these cases and, testing them, and also educating them to make sure that this disease doesn't spread.
All right, the medical doctor, Odunola Olabintan, thank you very much for talking to us on TVC News at 10.
Thank you so much for having me.